If your loved one has been diagnosed with schizophrenia, the first question you would ask is, what does the actual treatment look like? That's a valid question. And in this video, I'll give you overall view of the journey. What happens from the first doctor's visit to the long-term management. And this journey has a lot of intricacies because the treatment varies from person to person. But before we dive in, you need to understand one key thing. Treatment depends on when the intervention happens. Early diagnosis gives patients a better chance of managing the condition, and late intervention, like when symptoms have worsened, makes treatment more challenging. Now, let's say your loved one starts showing early symptoms like hallucinations, that is, seeing or hearing things that aren't there, like a voice calling their name, paranoia, like believing their food is poisoned or someone spying on them, and delusions, that is, thinking someone is controlling their thoughts. And to cope up with these signs, they isolate themselves, they avoid eating for days, or refuse to talk to anyone. As a family, when you notice some strange behaviors, you bring them to a psychiatrist, and this is where the treatment journey begins. The first step is getting the diagnosis right. Doctors will carefully evaluate the symptoms to make sure it's schizophrenia and not something else like bipolar disorder or severe depression. Sometimes there's even a dual diagnosis, that is, schizophrenia exists alongside another condition. Once the diagnosis is confirmed, doctors will craft a treatment plan. Remember 4 things when it comes to treatment. 1. The doctors prescribe medicines based on the symptoms. Depending on how they respond and the side effects, they will adjust the medications. This will be the first part of the actual treatment. And 2. Schizophrenia affects how a person thinks, feels, and behaves. So in addition to medications, doctors will put them into psychotherapy, and different types of psychotherapy will be given. 3. They might struggle with social skills. So as part of the treatment plan, they will be taught coping skills and social skills like how to communicate, how to manage their emotions, how to cope with their triggers, and how to navigate day-to-day life. And 4, support. The therapy will not just be for people struggling with schizophrenia. Family plays a major role in recovery. Therefore, family therapy is equally important. Caregivers need to learn about the condition and also how to manage their loved ones effectively. This is a general overview of treatment after diagnosis. Even after treatment, there are chances people will relapse. Sometimes the patient experiences acute psychosis, that is, they lose touch with reality and become a danger to themselves or others. At this point, inpatient care becomes necessary, and depending on the need, it could be either a hospitalization or a rehab center. In that case, in an inpatient setting in the hospitals, the focus will be majorly on stabilizing the patient, keeping them safe, and preventing self-harm. Once they stabilize, the patient returns to outpatient care, which is usually long-term care. Whereas in the rehab center, in addition to stabilizing, they will teach them to manage their life. This is a typical journey of schizophrenia treatment, and it is a long-term management. Thank you for watching and take care.